Saifie, Your Perfect Smile, a Doctor X Patient Roleplay. Viewer discretion. Script written by you/ElsaZeldaIce. Link will be in the description below. Go check them out. Thank you all for the support and enjoy the audio. Hello, and thank you for your patience. My name is Dr. Oh, it's you. I didn't realize you were my next patient. I hope you weren't waiting long. That's good to hear. I certainly do my best to keep a punctual schedule. I dislike being behind on my appointments. Patients get frustrated, making my job harder. Nobody really likes the dentist. You don't mind so much. You enjoy me taking care of you? That's lovely to hear, actually. I don't hear that often. Okay, let's take a look at your chart, shall we? Alright. So it looks like you're experiencing consistent pain in the lower left of your mouth, especially when chewing or biting. But you have pain all the time. Is that correct? And how long have you been experiencing this pain? Oh dear, that's quite a long time. You poor thing. You shouldn't have to suffer for so long. Didn't you consider coming in sooner? I see. You thought the pain was temporary. Huh? Wait, the receptionist said I didn't have any openings until today? That's unacceptable. Of course I would have fit you in sooner. I'll have a talk with her later. No matter. You are here now. That's what is important. Now, let me get some gloves and prepare my tools. Alright. Open your mouth wide. Let's take a look. You still have your wisdom teeth, is that correct? Yes, well, we did remove your lower right one previously because it was impacted, but we didn't remove the other three. Well, my dear, it looks like your lower left wisdom tooth is causing an infection. We are going to need to remove that one. Yes, sometimes antibiotics alone could help, but in my professional opinion, removing the tooth will help you in the long run. Besides, removing the infection, this will ensure no more infections occur there. I know the news can be disturbing to hear, but not to worry, because you're here with me. I'll take care of everything. Very good. I'll just fetch some additional tools and anesthetics and... I'm sorry. Did you say something? Do you have a question? Oh, my necklace. Yes, I always wear it. I never take it off. Why do I keep it on? It reminds me of someone special. No, I can't tell you. I won't show you. Not yet. Not yet. Sorry about that. I lost my train of thought briefly. Yes, the surgery. We should perform it today. Is there a problem with that? Of course you're nervous, but I promise you, the sooner we perform the surgery, the faster the pain will dissipate. You'll feel better, and that would bring me so much joy. Yes, it's safe to proceed with the treatment today. You didn't eat breakfast, so it's safe to give the anesthetics. And I have plenty of time in my schedule at the moment. We wouldn't want you to be in any more pain now, would we? How did I know you didn't eat breakfast? Well, you've told me before that you don't eat before your dentist appointments. You don't remember telling me that? Oh, how else would I know? Anyway, excuse me a moment, my dear. I will return shortly. You look nervous. Don't be. You are in great hands. My hands. You trust me, don't you? Perfect. Now, you won't need too much medication, just a local anesthetic and a general relaxant. That should take only a moment before it takes effect. I am truly sorry for this. Normally, you only occasionally come in for minor cavities. Probably because of all the candies and chocolates you consume. How did I know you eat a lot of sweets? Occam's razor. The more sweets you consume, the higher percentage of dental disease. But how did I know you eat a lot of sweets? My dear, who do you think sends you those treats? Your birthday, Valentine's Day, Christmas, Thanksgiving, Halloween, every occasion I can think of. Yes, it was me. I confess, you have been my patient for years, but I knew from our first appointment, I just knew that you were meant for me. Your beautiful smile, your perfect smile. I adore you. I would make sure appointment times are longer just so I could spend as much time with you as possible. But seeing you twice a year was becoming too painful. I couldn't wait that long to see you again. So it was simple. The clinic has all of your information, your full name, your phone number, your home address, your place of work. So I took it upon myself to send you gifts. The chocolates, the candies, the cakes. It pains me to ruin your teeth, sending you sweets so you would develop cavities, but I had to. Don't you see? I had to so I could see your smile. So I could see your eyes. See your lips. You consume my every waking thought. You intrude into my dreams at night. I had no choice. I don't like seeing you in pain, but knowing that I was the one to heal you, all I want to do is take care of you. Even those extra appointments weren't enough anymore. I learned who was in your life, what your eating habits were, where you go after work, how you relax at home, if I wasn't stuck working in this suffocating clinic. I was watching you. That's how I knew that you don't eat breakfast before our appointments. And that's how I know that you enjoy the desserts I sent to your house and to your work. And since I know that you still had wisdom teeth, well, your x-rays indicated that you were prone to develop an infection on this wisdom tooth. I even planned to only extract a single, as opposed to removing all your wisdom teeth at once, in hopes that eventually you will have to come back at least 3 extra times. Yes, of course, I knew you were my next appointment. I even made sure to not have anyone else on the schedule for the rest of the day. I saw what the appointment synopsis and knew my plan eventually worked. I needed to ensure that no one would interrupt our time together today. I alone, have the rest of the day to devote all of my time just for you. I'm here to take care of you. That's all I've ever wanted. All I ever think about. And, well, my necklace. The one you noticed. Do you recognize it? It's yours. Your wisdom tooth. Yes. From the previous surgery. I cleaned it, I kept it, and I always wear it. So I can keep you as close to me as possible. You know how hilarious this is? The irony is astonishing. I've had patients inflict damage and cause infections on purpose just to come see me more often, to get my attention, to pursue my affections, but I always push them away. Not only were they not my type, but I thought those doctor and patient stories were too ridiculous. I've heard rumors about colleagues and those cliche fantasies that people create in books or movies or whatever. But then you walked in. Why did you do it? Why did you take my heart in one glance? With Just a smile. My apologies, dear. I've been rambling. I'm sure you must have some questions for me. You have nothing to say? Or is it that you can't? It looks like the anesthetics are in effect. Now, just relax. Let me take care of you. That's perfect. So perfect. I promise I'll be quick. Just stay just like that. Here we go. See, that wasn't so bad. It didn't take long at all. Oh, still no words. That's alright. I'm sure you're feeling sleepy, and your mouth is numb. Let me just run my thumb across your lips. Oh, my dear. They are a little swollen. That's normal. Don't worry, you'll feel better shortly. In fact, I'll just take you home with me. I'll tend to your every need. I'll make sure you have food, give you your medications, just give you all of my attention. I have a lovely bedroom, A bed that is like a cloud. Satin sheets with plenty of pillows. Soft blankets galore. I'll even make sure the TV's hooked up. You can watch anything you like. I've got plenty of books for you to choose from if you prefer that as well. You'll need nothing. I'll give you everything and anything you could ever want. Shh, hush, hush. Hush, dear. Don't cry. Are you in pain? Oh, perhaps I should give you more sedation. Should last until we get home. Listen, it'll be alright, my dear. Let me wipe those tears away. See? All better. I'll take care of everything. You are in trustworthy hands. My hands.